of the pandemic, right? So I want to give you an idea of what the Republicans are going to be voting on today, just a rough outline. First off, enhanced tax credits. The same amount of money is going to be there, but it's going to go to a healthcare savings account. It's called an HSA. So you'll get a check. It'll have to go to healthcare. It'll go to that separate account. Then you can go shopping. That's what they want to do. So they think they'll save the HSS funds, depending on age, will be between $1,000 to $1,500. They claim they will cut premiums by 11% by cutting out the fraud and also rejiggering the eligibility, because way too many people were covered under Obamacare because we're in the middle of the pandemic and then people need desperate health care. This requires citizenships to get rid of some of the fraud. Obamacare, Washington Post even wrote about, Wall Street Journal went over it, is riddled with fraud and deception. So this time will require citizenship checks for Medicaid. That would certainly help. And this would block funds for abortion or gender-affirming care. So let's expand on this, the negotiation, as well as what's going to be in play, and that is with Senator John Barrasso. He's the majority whip, and he is a doctor, and people lean on you, Senator, because you have expertise and understanding what it's like on both ends of this as the patient as well as the physician. So what else could you say? The same amount of money, but it's just directed more efficiently, right?
That's absolutely right. We want to put patients in charge. Brian, the Democrats are coming to the Senate today to do another bailout of Obamacare. And I'm a doctor. I want people to get the care that they need at an affordable price. But Obamacare robbed people of affordability as well as choice. And if the Democrats get their way, they will send another $83 billion directly from the federal government to health insurance companies, which, you know, what have we seen with these things? That just raises prices even further. President Obama said, hey, if you pass this bill, premiums will go down by $2,500. Instead, they doubled. An insurance company, their stock prices are up 500 to 1,000%. So they're licking their lips for this $83 billion additional dollars. And you're right, as you said, these new premiums, this new support, this is all related to the COVID bonus Biden payments. Those are supposed to expire this month. Democrats say, no, we need another 3 years, $83 billion directly to insurance companies, taxpayer money, and this is just riddled with fraud and abuse.
There's two things. I don't really know Democrats who said, I have to make sure the insurance companies make money, and I think their stock price is up over 1,000%. And the other part is, not many people, no one's pro-fraud. Do you know, for example, because you're not going to have enough 60 votes, you do the one, you're whipping these votes. I don't know one Democrat that's going to go for your plan. I don't know one Republican that's going to go for their plan, which is just a 3-year extension. So do you think that there are some Democrats that are concerned about Obamacare, are concerned about fraud, are concerned about the insurance companies getting this money?
Well, they really ought to be, because the research done by the Government Accountability Act pointed out your $21 billion that went out in 2023 alone under Biden, that they said no verification. So we know some of that money went to illegal immigrants. We also know that they have no income caps whatsoever. You have millionaires that are getting this Obamacare welfare. It is all wrong. The researchers from the government looked into this. They made up fake accounts, sent them out. And 23 out of 24 got in. They never asked for verification of citizenship, never asked for verification of income, and that's why there's so much potential for fraud and known fraud. But you know, Brian, you send more money to insurance companies, the prices just go up. We need to send money to patients, empower them to make the decisions that what works best for them, make the insurance companies compete for those dollars, give people more choices rather than this one-size-fits-all straitjacket that's Obamacare. So,
Senator, just so people know, if these premiums go away, you're going to see some of these things. Medical inflation will outpace as we roll through all goods in 2000 to 2024. Medical care will go up 121%, and all goods and services will go up 86%. If subsidies expire, low income people making $22,000 or more will have $0, $66 a month for middle income. If those people make $35,000 and up, it'll be about $218 a month more. Older middle income adults, their rates will go up about 508%. So because of the COVID subsidies, people are used to paying a certain price. And we also know the coverage isn't good. It's been a major letdown. But in the short term, which means in the next 2 weeks, do you sense that there might be some compromise here?
Well, senators are working together to talk about ways to actually lower the cost of care, not make insurance companies more profitable and just send money to insurance companies. But you're right, Brian. Affordability is a major issue in this country. Republicans are focused on putting more money into people's pockets.
Do you think the president has to get involved? Do you think the president has to get involved?
I'm going to be at the White House later this afternoon talking with the president. The president's focused on affordability on all ways, in terms of gas, in terms of groceries,
right,
in terms of electricity, heating, and housing. All of those things are critical. That's why we've passed this past summer our Working Families Tax Cuts Act, and so much of that kicks in 2026. People will see more money in their pockets, and we're just getting out of the pain of these 40-year high inflation under the Biden administration, which was absolutely awful. And the Democrats, all their answer was raise taxes by $4 trillion.
Well, you got a couple of weeks. There are some people in the House and Senate that do want to get something done, and hopefully they'll do it. And the president will